we started the day and we talked to the audience about how many people were receiving CHC funding across the country. And we asked them to go and give us some ideas of what they thought. So we started about 20,000, we went to 15, we ended up at 60, and that's the right number. So at any one time in this country, 60,000 people are in receipt of CHC funding. The next question is about how much we spend on it, because we know for individual clinical commissioning groups, this is a high risk area financially, clinically, reputationally. And we guessed £1 million, we guessed £1 billion, we guessed £5 billion, and the real answer is around £2.5 billion. We talked about the fact that various people provide guidance on what we need to do around continuing healthcare. So NHS England are obviously critical as part of that. And we talked about the fact that we have a national decision support tool, and it looks at needs across 12 domains. And we asked people to shout out what some of those domains were. And that was really for people who are less familiar with the ins and outs of what CHC staff deal with on a day-to-day basis. The other point we made at that stage was eligibility isn't related to a particular condition. Sometimes people think if you're diagnosed with something, you will automatically become eligible for CHC funding, and that's not the case. It's about needs. We went on to talk about some of the national policy drivers around continuing healthcare, and we were really clear about the fact that the NHS needs to align CHC with the principles of the 6 Cs. And at that point, when that was introduced to the audience, there was a lot of nodding going on. A lot of people are bought into those principles. We also talked about the fact that we really need to work on integration between health and social care. We only have to look at what's going on in Manchester, what may happen after the election, to know that this is becoming a greater and greater priority. There's other things like the implementation of the Care Act, which happened yesterday formally, but obviously its ramifications will go on for time to come, that we need to be cognizant of from a CHC point of view. We talked about the 5-year forward view, and one of the things particularly that highlights, which is around the increasing personalisation agenda, and we talked about personal health budgets as well, and the challenges from that point of view, and the real excitement about the fact that personal health budgets is a growing area. The other thing that we talked about, which you'll see on the diagram, is some of the national issues. So one of the things we talked about, this is a high cost area, it's a high risk area for lots of clinical commissioning groups. We're in a growing and ageing population as well, and there's increasing complexity in cases. We also know that families, fantastically, are becoming much more aware of their rights, but that obviously has knock-ons for teams working with families, and really a need to work with families in a much more family-centred way and change the culture of how we may have worked with families previously. One of the things that we talked about, which again the audience were in much agreement with, was the growing legal involvement in this area of work, around challenges to the process, around supporting families throughout the process. And sometimes that causes some difficulties and a lot of pressure for teams as well. We then went on to talk about some of the other work that's gone on at a local level and some of what we've learned about evidence-based practice in other places.
Having worked in continuing healthcare for 15 years, it is a vision of where we are from where we were 15 years ago. In those days, there was very much seen as CHC service in isolation. It was seen out with of mainstream services. And there were local policies that were deemed to be a postcode lottery for patients. It wasn't transparent, it wasn't clear, and the operational guidance for continuing healthcare was very much driven by a local level. Things have changed. We now have the national framework, we have the tools, things are more transparent, they are more clear for patients. But actually, what we need to do is we need to focus on getting it right for the patient, making it patient-centred, making it right for them. The policies have allowed us to facilitate that change, and there is a recognition that there is an expectation that we will do more with less. But we should not remove ourselves from the fact that the patient and their families are at the centre of all of this. And that we need to work in a very much an integrated approach where CHC is everybody's business. There are some challenges that we will face. We need to talk about the integration of services, including information technology, communication, and other things. So we accept that there are challenges. However, the main message is that this is everyone's business. We should be working together to make the very best for our patients, our service users, to make it good for them.
Some examples that we've seen nationally are around the 6 Cs, and really importantly, working in an integrated manner with social care. There's so much that we can learn from social care in terms of deprivation of liberty safeguards, best interest assessments, and it's really important that we all work together on that. Embedding the 6 Cs in staff objectives in line with the new policy that's just come out too is crucial to making this happen for patients. Another area that we feel from the learning that we've had is around CPD and making sure that CPD is really robust, that it's part of the induction that people have, and that staff that are competent and feel competent will feel far more motivated and will have much happier teams, less stress, more retention of staff and more recruitment, which is really what we need as well. Another area where we were talking to people, they were saying it's really important that leaders listen, and that the leaders that do listen make the change. And that's important for staff and also for people and their communities. There's been a real focus around learning networks when we've been talking to some of the other areas, particularly around personal health budgets. So we really need to learn from what's going on out there at the moment.